month of May, we celebrate and observe women's health. And today we are joined by Dr. Tom Boyden, a cardiologist from Spectrum Health Medical Group, to discuss an upcoming lecture he's giving on women and heart health. Thanks so much for joining us today. So specifically, you're talking about sort of that aging process and how it impacts women when it comes to their hearts.
Absolutely. You know, it's very important for women to understand their heart health. There's a lot of things that change about risk with women and their heart health as they age. And it's very important to understand that heart disease is the leading cause of death for women. Women are 6 times more likely to die from heart disease than they are from breast cancer. And they're more likely to die than men are. And that's, I think, a often misunderstood fact.
Yeah, I know. And it is interesting. It's a little scary, too, as a woman in her 50s. It's, for me especially, I've got a family history of heart disease on my dad's side. And so this is really top of mind for me, especially as I get older.
Absolutely. You know, I would tell you, if you're over the age of 45, if you're even getting into that perimenopausal area, you definitely need to have a conversation with your physician about your heart health. Menopause can affect your heart risk. You know, as the hormonal changes take place with menopause, the risk really increases for women. And that's why women develop heart disease a little bit later than men, but that's when their risk kind of equals that of men.
It's interesting to look at some of these other increased risk items that are on the list here. The time when we start our menstruation cycle, either young or a little on the older side.
And again, I think that goes back to hormones. You know, if you start your menstrual cycle early, your hormones have changed early. They may change earlier again. If you start it late, you've had that lack of estrogen effect throughout your childhood, which provides that protection. And there's also some changes that can occur when being pregnant. You know, if you were pregnant and you developed diabetes or you developed hypertension as a result of the pregnancy, your long-term risk of heart disease increases.
Okay, and so any of those kind of changes, almost like a red flag to
Absolutely.
say you absolutely have to listen to your body and have a good communication
Absolutely.
with your doctor.
For sure.
Okay, so there are things that we can do to decrease those risks. Obviously, you know, our heredity, our hormones, those are things that maybe we can't do a whole lot about, but there are some things that we can really do in managing our risks.
Absolutely. I mean, you need to understand both the risks you can't change, like you just mentioned, your family history, your age in life, whether or not you've been through menopause, but you really have to focus on the things that you can change. You know, just having a family history or being menopausal does not give you a death sentence for heart disease. You have to look at this and say, what can I do? And I would tell you, if you live a healthy lifestyle, and that means getting yourself to a healthy weight, being active on a daily basis, changing your relationship with food, I think, is critically important. If you think of food as your best medicine, it could potentially save your life. And if you follow those things, you reduce your risk of heart disease and dying from heart disease tremendously.
Yeah, working and managing our stress level as well. And I'm guessing at some point, making sure you get enough sleep is also a big part of the management of this.
You know, depression, anxiety, stress, we all know cause or lead to heart disease. Sleep disorders are on the rise, you know, and part of that's because of people being overweight, but part of it's because of stress and just not having healthy sleeping habits, and all of that increases your risk because you're living at these higher levels of stress hormones that can cause vascular disease.
Yeah, and I know at Spectrum Health you do a great job in developing relationships with your patients. You want to make sure that they understand that you're a partner in keeping us all healthy along the way. And to that end, you have great information sessions, Doctor Dialogue series.
Yeah, we do a Doctor Dialogue series every year. This May we're focusing on women's health. It's going to take place May 24th at Calvin College in the Prince Conference Room. Starting at 6 o'clock. It's free to the public, but you definitely need to register, and there's a phone number here you can call to register. You can go online and register. We'll be talking about the hormonal changes that occur with women as they age, how that affects your heart health, your bone health, your pelvic health. We'll talk about some of the sexual changes women go through. There's going to be a panel of experts there, and they'll give brief presentations, but the main focus of this is for the people who come and ask us questions, whatever's on their mind. If you've got the question in your mind, somebody else has it, and don't be shy.
Yeah, and these are great opportunities for people to come because maybe you have a question that you've wanted to ask but haven't found the courage, or maybe you don't have a great relationship. Somebody else in the audience is going to be asking that very same question.
Absolutely. Absolutely.
Yeah, and so again, it's free of charge to attend. You don't have to be a patient at Spectrum Health Medical Group to
Correct.
attend, but you do have to register.
Correct.
Fantastic.
And registration is already open, and it's filling up quickly, so if you want to attend, please get online quickly.
Yeah, and a variety of different experts will be there. Your coworkers who will
Correct.
help answer all those questions.
Absolutely.
Thanks so much. Great information.
Thank you for having me.
And stay right there. More of 8 West when we come back. Don't go away.